right, everyone. This is our fifth episode of our quarantine series. We have a very special guest, Reagan Harrison. She's with Lifepath Systems. She's the mental health first aid coordinator and outreach specialist. So we've been doing this quarantine series since the beginning of community transitions due to the coronavirus pandemic. And so if you haven't been following along, please check out our other videos. We've been doing several videos on introvert, extroverts, how families can engage with their children due to the pandemic, and all sorts of other topics. So please take a look at that. But today we're going to be discussing the resources that are available to the public and some things we can touch on to make sure that we're able to take a look at our own mental health and the mental health of our families. So typically, MHA Dallas, Mental Health America of Greater Dallas, our goal is to make sure that everyone has preventative services. So our philosophy is before stage 4. Before stage 4 is basically saying, like any other health disease, heart disease, cancer, diabetes, when you start getting the first symptoms, you do not wait until the illness becomes terminal. We want to make sure that we engage our physicians, we get the right medications, and start treating our bodies to make sure that we are able to tackle the disease before it gets worse. And the same thing is with mental illness. So in this case, Lifepath Systems provides some services, and Reagan will go over that, that we can engage our families and ourselves and make sure that we get the services we need. So Reagan, please tell us a little bit about yourself and a little bit about Lifepath Systems.
Hi, Megan. Thank you so much. The first thing I want to say is that I love that before stage 4. Later on in this presentation, I'll talk a little bit about mental health first aid, which is my passion over at Lifepath Systems. And we talk about that a lot, leaning in at sadness, really working with people that we know and love and even just happen across in our community that might need us to just ask them, how are you today? And so I love that. What an amazing idea for Mental Health America. So as Megan said, Lifepath Systems is somewhere that a person in our community can go for some of that preventative care before stage 4. So Lifepath Systems is the local behavioral health authority for Collin County, which basically means that anyone in Collin County, regardless of income or insurance, can come through our doors and receive any of the services that I'm going to talk about just very quickly today. So let's start off with, what are the 3 divisions that Lifepath Systems has? We have a behavioral health division, which is going to be your mental health side of Lifepath Systems. That's kind of what most people would think about when they think about a community mental health center, is our behavioral health division. We also have an early childhood intervention division and an intellectual and developmental disabilities division. And I'll cover each of those real quickly. We have 2 behavioral health clinic locations, one in Plano, one in McKinney. Both of those are our outpatient clinics. We also have a crisis center located in McKinney. Those 2 outpatient clinics are open 8 to 5 Monday through Friday for individuals to walk in and receive services. We are still open during this pandemic. However, we have addressed people's fear of wanting to come out into the community, and also obviously wanting to stand by the stay-at-home order. And so we've created some new ways to receive services as well that we'll talk about a little bit later. But those are our 2 locations where we operate out of for our behavioral health clinics. Behavioral health services that a person might be able or would be able to get through Lifepath Systems include medication management services. So when we're thinking medication management, we're thinking visits with a psychiatrist and those prescription services that come with that, counseling, substance use disorder and treatment services, case management services, which is things like skills training and psychosocial rehabilitation. Our skills trainers are extremely skilled individuals that work with every individual we serve at Lifepath Systems. and they work on anything from how to have a better conversation with the people in your family and the people that you love, to how to deal with your own triggers of your anxiety and depression. We also have care coordination and specialized services, including supported housing and employment, diversion services. We have a military veteran peer network and mental health first aid trainings that are offered free to the community. Some really cool things that we try to do to serve the individuals that work with us at Lifepath Systems is really see where their needs are and where their gaps in services are. And our case managers work really hard to work with individuals and services on those gaps in their lives. So if they're struggling with rent or utility payments, things like that, we want to help them as much as we can to have their basic needs met so that they can really focus on working on their mental health treatment and improvement. So our early childhood intervention division is for children ages birth to 3 and their families. And that division serves our kiddos that are maybe having some developmental delays. And so think maybe not talking as quickly as we'd like to see, or self-feeding as quickly as we'd like to see, or even walking as quickly as we'd like to see, fine motor skills, gross motor skills, things like that. And so our early childhood intervention division offers screenings and assessments, specialized skills training, physical, occupational, speech, and language therapy. We have activities to develop those learning skills that a child might be off with. Our early childhood intervention specialists will come into the home and work with the entire family on skills and activities and education that can help get that child up to speed. So that's really incredible. And then we have our intellectual and developmental disabilities division. So when we're talking about our IDD division, we're talking about individuals with an IQ of less than 70, and some of those individuals along the autism spectrum. And so it's important to get with our incredible individuals that work in our IDD division as early as a parent may think that a child has a struggle or has a problem. Because there is a list, a state waiver list that it's important to get on. And if anyone would like to get more information about anything that I've spoken about today, at the end of this PowerPoint is a contact information for me. Please feel free to email me and I will get you all the information and get you connected with the right person over at Lifepath Systems to get you the most correct answer. So what are some things that we offer in our IDD division? We offer service coordination, some respite care services, home care services, some occupational therapy and physical therapy, skills training, those behavioral supports. We have a really incredible supported employment division for our IDD individuals, and then sometimes residential and home community services programs. So the other thing that I think personally is incredible about Lifepath Systems is our crisis hotline. We have a crisis hotline that serves everyone in Collin County. You can call this number if you're having a mental health crisis, or if someone you see is having a mental health crisis, or a family member is having a mental health crisis, and someone will answer that phone 24 hours a day, 7 days a week, no exceptions, and work with you through that crisis. Now, on top of that, if the person on the phone is not able to work with you to resolve the crisis that you're experiencing, we do have what's called a mobile crisis outreach team. And a team of 2 individuals from Lifepath Systems will come to any location on Collin County soil and provide an assessment within the community to create some stabilization in the least restrictive environment for that individual. The goal of that is for us to reduce the amount of inpatient, ER, and law enforcement interventions people within the community are having to do when they just don't know who else to call. Maybe a friend or a family member is talking about some suicide and we don't know who to call. Instead of calling 911, we can call the crisis hotline and get someone out there to help us deal with that situation. So it's really an amazing thing that we offer in Collin County. Lifepath Systems has also partnered with mySTRENGTH, which can be used as a desktop application or an app on a phone. And mySTRENGTH is this incredible resource that has education and activities and tracking for managing depression, controlling anxiety, reducing stress, drug and alcohol recovery, improving sleep. what you see on the screen right now is a snapshot of what it would look like on your phone or your desktop device. And you can click on one of those featured topics and it will pop up with evidence-based information about depression or anxiety or stress. And then we'll also give you some specific activities to walk you through managing those things or having conversations with others about those things. It really is an incredible opportunity. Lifepath has partnered with mySTRENGTH to make that free for everyone in our community. Individuals might find that it reduces crisis within the community. It hopefully will build some resilience and add resources for people in our community. And even create some stress management. I know that I can jump on mySTRENGTH if I'm having trouble sleeping, and it will walk me through a meditation exercise, for example, for how to get some better sleep, some calming all of my muscles, those kinds of things. It really is an incredible opportunity that we have given for our people in the community. And I apologize, I don't have my slide here, and I don't know how I made that mistake, but Lifepath Systems has offered this for free to the community. So if a person wanted to have mySTRENGTH, they would just need to go to their app store on their phone or Android device and download mySTRENGTH. It's going to look like what you see on the screen there. Or you can go to mystrength.com on a desktop device and download. And it is going to ask you for your email address and for a code. And that code is LPS, as in Lifepath Systems, COMM, as in community. So Lifepath Systems Community, LPS COMM. And I'll get with Megan and make sure we post that on this post as well. Again, any questions about mySTRENGTH, please feel free to email me at the email that you're going to find at the end of this slide. The other thing that Lifepath does within the community is offer free mental health first aid training. So mental health first aid is an 8-hour public education system that's kind of like CPR, but for mental health. So we walk participants through what some of the common disorders are that are affecting today's population, what are some signs and symptoms, what are some things to look for, when to lean in, and then action steps for how to lean in the same way that you would check a person's responsiveness, open their airways, and start breathing in compression, because those are the action steps we learned in CPR. Mental health first aid gives you action steps for assessing for risk of suicide or harm, listening, giving reassurance and information without giving advice, and encouraging the appropriate recovery or treatment that will work for that individual. It really is an incredible program. We get amazing we get amazing testimonials from individuals that have taken this program. We offer 2 programs every month for free of charge. We offer an Adults Assisting Adults program and an Adults Assisting Youth program. We also are out in the community giving this program to churches, schools, company HRs. The city governments have taken these programs. It really is incredible. And if you're interested in possibly attending one of those trainings, you can email us at mentalhealthfirstaid, MHFA, at lifepathsystems.org. That email will go straight to me, as I am the coordinator, and we will get you set up to take a course, save a life, and strengthen your community. So this is my contact information. Again, my name is Reagan. My email and cell number are up on the screen for you. And I know that I covered a lot, so I'm going to let Megan kind of disperse through and ask any questions that she might have.
Yeah, great. I mean, what you guys offer is incredible, and so it's priceless to the community, because a lot of times that you guys are basically a one-stop shop. You serve mental health needs and behavioral health needs, and not just for adults but for children too. And that falls into our before stage 4 philosophy, that if you see that your child is just not meeting those benchmarks, and maybe you just need a little bit of help, that you have a place to go to, and that they can do those screenings for you.
Absolutely. And there's always, the great thing about Lifepath Systems is the worst case scenario is that you call or go through a screening and then you decide that we're not for you, and you get other resources within your community. There really is no downside to giving us a call or walking into our doors and asking for help.
Yeah, that's awesome. And, that's great that you guys are able to resource out as well, maybe something a little bit closer to the home. Or maybe, like you said, not a right fit and just trying to find the right
Absolutely.
fit for your family. You said that you serve Collin County. Do you need insurance to get any of these services?
So you don't need insurance. LifePath Systems does accept certain insurances. That is not my area, and so it's not something I know enough about to speak on intelligently. What I do know is that not having insurance is absolutely not a prevention or a barrier to receiving services. We serve individuals all day, every day that don't have any insurance or are Medicaid or CHIP individuals. So as I said, it really is all about walking in, or as of right now, calling and going through that initial screening. And a financial screening is part of that, where we will talk to you about what is happening for you and your family right now. What are your goals? What is your insurance situation or your income situation or your job situation? And how can we make sure that you're getting the help that you need, regardless of what your barriers might be?
Right, that's awesome. Some of the things that I think some others might touch on is, uh, the steps that we need to take. And your organization, LifePath Systems, makes it really simple just to make that first phone call or maybe even an email. And during this time, while we're in our homes, we're afraid that, well, I can't come to the clinic. You may have already said this, but I just want to clarify that you guys do offer telehealth, which is, you may be able to access treatment through the phone or via webcam.
Absolutely. I'm so glad you brought that up. So normally, under our everyday living, we would ask for people to walk through the doors of either one of those clinics we talked about in order to get behavioral health services and sit down with somebody for a face-to-face screening so that we can really get them to where they need to be. During this pandemic, we have worked really hard, and our staff has just really gone above and beyond to make it possible to have people in the call center so that when individuals call our LifePath Systems phone number, which I will give you in just a moment. I'm sorry, it should be on my thing here and it's not. But again, you can email me and get that phone number. Call our LifePath Systems phone number. That person on the phone can connect you or create an appointment to connect you with a licensed individual to do that initial intake. And then from then on, everything can be done through telehealth. We are working really hard with our staff and our telehealth to make that possible during this time of the unknown. And that phone number is 972 544 5939. And so we can make sure we make a note of that as well.
Great. Yeah, no, I'll definitely put Life Systems information in the description. So if you're watching and
Amazing. Okay, that
yeah.
makes me feel
Yes, and whoever's, all of you that are watching, these slides are super instrumental and great tools. So please go through the video. If you have any questions, refer to those slides. And when you have a question, call LifePath Systems, and I'm sure they'll give you the information that you need. Thank you, Reagan, so much. You've given us so much information that is just, it really feeds into our before stage philosophy that, the access is there, the resources are there. It's just up to us as a family and within the community to start the conversation and just say, hey, there are people out there willing to help and ready to help those with mental health conditions, that these services are accessible and that we can really take that first step to getting the treatment that we need, and especially for our children as well. So thank you so much, Reagan Harrison. To everyone else watching, like the video, subscribe, please leave a comment, let us know what you're thinking. So if we need to get you out into the community, become an advocate, or even get you some resources, we can do that to you. So
And
thank you so much.
sorry, Megan, I do just want to jump on really quickly and let everybody know that Lifepath Systems is also doing a weekly series. And so if you want to jump on our Facebook page at Lifepath Systems, that would be a good way to stay connected. We are here. We are not going anywhere. You are not alone. And we want people to reach out if they need us.
Great. Awesome. Thank you so much, Reagan.
Thanks, Megan.